Hello, and welcome to another episode of Let's Talk About Shh. This podcast is aimed to help you navigate your relationships, maximize your pleasure, and get the most out of your sex life. Each week, we cover different topics related to the full spectrum of sexuality and romance. If this is your first time tuning in, my name is Tila. I'm a sex educator, relationship expert, and published author. I love doing this podcast, and it's because I love helping people connect with and understand their own sexuality and foster healthier relationships. There is so much information out there, and often it's people just don't know where to start. So if you're struggling with an area around sexuality and relationships and have a question you'd like answered, please send in your questions to questions@exploresextalk.com. And of course, please feel free to check out my website. There's tons of articles on there, exploresextalk.com, and lots of different types of information to help you up your game. Okay. Today, I want to talk about a couple of things related to vulva and vaginal health. Now, before we dive in, I just want to clear up a few common questions that people have about vulva anatomy and terminology. Usually when we're discussing private parts, there are the usual words that come up like penis and vagina. In fact, there's a whole list of colorful slang that people use to refer to their genitals. Now, a lot of these words can sound silly or encourage us to relax when talking about sex, or they can be used as insults. Either way, we are going to disregard the slang for now, but you can always Google some fun lists. There's lots of colorful terminology out there. But let's start with some actual anatomical terms. Now, human bodies are incredibly complex, and our reproductive organs are no different. And when we get down to really talking about anatomy, there's actually a name for each piece of the reproductive system. And when it comes to vulvas, there are a lot of pieces. Now, I've had more than one person ask, what is a vulva? It's not a term that everyone understands or knows the meaning of, so let's just clear this up. The vulva is actually the name of the entire external part of the reproductive organ. Now, this includes the mons pubis, the clitoris, the labia major and minor, the vestibule of the vagina, the bulb of the vestibule, and the Bartholin's glands. I don't know if I pronounced that right, but there it is. Now, that's a whole lot of parts. And most of you are probably like, I don't even know what that means. I think that's not really something we can talk about in this podcast. It's a little too difficult to describe without pictures, but feel free to check out some sources online. I'm sure you can find a diagram, or if you just take a look at a medical textbook, I'm sure you will find another diagram. Anyway, each of these pieces serve a different function in reproductive health and sex and sexual pleasure. The common question that usually follows is, what is the difference between the vagina and the vulva? Well, the vagina is still part of the vulva, but it's the internal part that accepts penetration from a penis or fingers or toys or whatever you happen to be using. Obviously, the vagina is an incredibly important part of reproduction and sex, but it does tend to get talked about more because it's the connection that bridges the external to the internal part of the reproductive system. And there's also a lot of really interesting things that happens in the walls and the surrounding areas of the vagina, particularly when we're talking about reproduction. Some people then follow up with the question, why are we talking about the vulva at all then? And the reason is that as wonderful as the vagina is and can be, lots of people don't experience an orgasm simply from vaginal stimulation. So when we talk about the vulva as a whole, we open up the conversation to more options for sexual pleasure, as well as other important health knowledge. Talking about only one piece of the vulva is kind of like talking about just the nose or the mouth, instead of talking about the whole face. Each part has an important purpose, and we can talk quite extensively about each individual part and what role they have to play, but we still talk about the face as a whole. Now, we don't really currently have a lot of words, or a lot of good words, to describe the reproductive system as a whole, aside from using outdated terms like female reproductive system. Describing the whole this way isn't really gender inclusive and also places the focus solely on reproduction. Reproduction is a super important part of sex, but it's not the only part of sex. For all these reasons, it's given rise to language like people with vulvas, vulva people are vulva bodied, and of course their counterparts, penis people, people with penises, penis bodied. We're going to explore gender inclusive language in depth in a later episode, but the point I'm bringing up is that this type of terminology has also created a more commonplace understanding of using the term vulva to refer to the whole system, in a similar way that people use penis to refer to the whole system or reproductive organ, despite the fact that it's comprised of a number of different pieces. So now that we've got the basic terminology down, let's take a little look at how we can keep vulvas healthy. One of the first things people worry about is smells or unusual odors, and that can be coming from the vulva. And what kind of odors are healthy? How do you know when it's an unhealthy odor or a bad odor? When is it time to go see a doctor? Odors are really important because they can be the first sort of step or first way to identify that something may be wrong or that we may need to change something. As I mentioned before, vulvas are an incredibly complex system. They have their own pH balance, produce their own healthy bacteria and fluids that actually naturally clean the vagina. Every vulva has its own natural odor, but sometimes that odor can be different or unpleasant. Now, there are a number of things that can impact the smell, and when in doubt, it's always a good idea to check in with a medical professional just to make sure it's nothing serious. But we're going to cover some basics because a lot of things can just be changed by some simple different choices. So one of the things that can impact smell is hygiene. It is no secret that people sweat. When we get warm, we sweat, and we sweat from a variety of areas in our bodies to release heat and help us cool down. Now, the crotch, like the armpits, is one of the areas where sweat is released. And sweating in our groin can actually be intensified by the kinds of clothes we wear and the fabrics that they're made of. So if we're wearing really tight clothing with fabrics that maybe don't breathe very well, this can trap a lot of sweat and bacteria, which can generate some bad smells. Generally, we want to choose underwear that is made out of natural fabrics that breathe, things like cotton, and this is a lot better over synthetic fabrics that are going to trap heat and sweat. Smells of the vulva can also be impacted by the kinds of soaps or cleaning products that we use. So some soaps can actually upset our natural pH balance, or they may just be a little too effective and clean away all that good bacteria that the vulva needs to sort of keep the vagina clean. And when these balances are thrown off, it can cause a funny smell and may even progress to an infection. Another thing that can impact our smell is diet. So when we eat certain foods, any strong odors that are associated with those foods tend to come out in our sweat. Things like garlic or asparagus or, other similar foods that are known for putting off a strong smell can impact how we smell. There are people that argue that there's absolutely no scientific evidence to support this. However, there is a history of anecdotal evidence that suggests that it does make a difference. You know your body best. I think there is some variability for, your biological makeup and your ethnicity and all that that's going to impact how much diet is going to impact your own personal smell and your vulva smell. So just something to keep in mind. If you are noticing a strong, unpleasant smell after, maybe a few meals of unhealthy food, try switching up your diet for a few days. And if that doesn't help, diet may not be the reason. You may want to go check in with your doctor. A third thing that has a significant impact on odor is our menstrual cycle. Now, at different times throughout the month, the vulva can actually give off different smells depending on where a person is in their menstrual cycle. Throughout the month, the body releases a variety of different hormones, and these changes can actually change the type of smells that the vulva releases. So just once again, another thing to keep in mind. It's also important to remember that if a person's using tampons during that time of the month, just to make sure that all tampons are actually properly removed in a timely fashion. A buildup of menstrual blood from a tampon that's maybe been left in a little too long can also result in some unpleasant smells and once again run the risk of developing an infection. Sexual activity is another thing that can change vulva odor. Some types of products like condoms, lubes, spermicide, toys can also interfere with the pH balance of the vulva. Even things like, what cleaning agent do you use on your sex toys? Is there any residue from that cleaning agent that's maybe left on your toy? Things like that can impact people. This is also why some people may experience burning or itching after using some products. Now, of course, once again, everybody is very unique. What brands impact some people may not impact others. Just be sure to pay attention to any irritation that comes from anything used during your sexual adventures. Is there any irritation? Do you notice smell or any discomfort in the days following? That can be some big clues that you may want to try a different product. Unusual smells can also come from having unprotected penile vaginal sex. The natural semen of one person can actually interact with the natural bacteria in the vagina and cause that unusual smell. One of the last major causes of a change in odor is actually through infections. And this is the thing that we really want to be keeping an eye out for, because there are a few different infections and they can all kind of cause a unusual or unpleasant smell, but they can range from things like, a yeast infection to a sexually transmitted infection. And if you suspect that an infection is present, it's really important to follow up with a medical professional as soon as possible, because depending on the type of infection that's present, the treatment required and the possible impacts of your health are going to vary. And it's much better to be safe than sorry. Safeguard your health and get checked out and make sure that it's not too serious or that it can't become serious if you risk waiting too long. And we can do a lot of different things to safeguard ourselves from infections, and many of them are super simple. I've already sort of touched on some of them already. We should be aware what type of fabrics that we're wearing, particularly our underwear, how tight our clothing is, making sure we have a little bit of breathing room in the groin area, making sure we're choosing soaps and products that we don't have a reaction to. Another big thing that we can do is peeing after sex. Now, you've probably heard people talk about that, peeing after sex, and if you're a woman, you've definitely heard this probably multiple times in your life. But what's the point of it? Is it mandatory? Should everyone pee after sex? I mean, obviously urinating is super important. It serves a very important function in our bodies, and one of those functions is that urine acts as a natural cleanser. So when we pee, we're not only flushing out waste, we're actually cleaning out bacteria that our bodies don't like before it can actually become a problem. And when we have unprotected sex with someone, we're actually exposing our bodies to bacteria that may be on their skin. Now, this bacteria may be from around their anus or carried in their sweat or from their mouth or from any number of other places, maybe things that got caught in their clothing. It's also possible that it could be in part of the person's natural body, because, as I mentioned, not all bacteria is bad. But regardless of what type of bacteria it is, because it's foreign to our bodies see it, as something that should be like fought and destroyed. And it basically kicks up our immune system. And our immune system, goes about attacking these foreign elements, and that can actually throw off the vulva pH balance and cause an infection, because the immune system tends to go a little bit overboard sometimes, which can actually leave us open to infections. It's also possible that some of these foreign elements may have a chance to travel up the urethra to the bladder. And when this happens, it can cause a bladder infection. Now, typically these are usually called a urinary tract infection or a UTI. UTIs can be quite painful. The most common symptom that people talk about is discomfort or pain while peeing or urinating, and sometimes some discomfort from like inflammation, so sore back, sore pelvis, that sort of thing. But it's important to know that anybody can get a UTI, but it's significantly more common for anyone who has a vulva. People with penises tend to have a longer urethra, so it's less likely that the bacteria can actually travel far enough to get up into the bladder to start an infection. People with vulvas tend to have shorter urethra, so getting a UTI is a lot more likely. Now, if you've never had a UTI before, there's a couple things to know. It can happen in any part of the urinary system, so it could be an infection of the kidneys or the bladder or the urethra. And depending on which part of that urinary tract the infection is in, the symptoms can really range. So it can be things like burning when you pee, a strong persistent urge to urinate, maybe only being able to pass a small amount of pee. The urine can sometimes appear cloudy or red or bright pink, or maybe even like a Coca-Cola colored. Sometimes the urine can smell really strongly, or people can experience pelvic pain. There's some symptoms that are more common to specific areas. So, for example, if the infection is in the kidney area, people can experience upper back or side pain. They might have a high fever or be nauseous or vomit or experience shaking and chills. Versus if the infection is in the bladder, they're more likely to experience like lower abdominal discomfort and pelvic pressure, extremely painful urination, or maybe blood in their urine. And finally, if the infection's centered around or in the urethra, a person is more likely to experience discharge and that really intense burning when they pee. So I wanted to mention all these symptoms because I know it's not like why is she talking about this? This sounds terrible. It is terrible. If you've never had one, I hope you never ever get one because it's very uncomfortable. But it's also really important to know these symptoms because if you do experience them, you should be seeing your healthcare professional as soon as possible. Not only because your discomfort is just going to continue to grow, but untreated infections actually become harder to treat as they go along. And they can spread into the bloodstream, which can lead to sepsis, which is a life-threatening event. So it's definitely not something you want to like hang on to or just be like, oh, maybe I'll just see if it goes away. Please go see your doctor. And when you go see a doctor, just for anyone who's never gone before or had these symptoms before, they're going to give you a test to confirm the UTI. Usually that's like by doing like a urine test. They'll ask you to provide a sample. And the sample usually has to be like midstream so that you don't get any bacteria from the skin that could contaminate your sample. And if the test indicates an infection, they're going to discuss what's the best options for treatment. Now, fortunately, most treatments are fairly simple. It's usually a regimen of like oral antibiotics, but in more extreme or advanced cases, it may call for not UTI. We're talking about UTIs. In extreme or advanced cases, it might call for IV treatment. So that's not super fun, but important. Anyway, regardless, once the treatment's started, you should start to feel better within a couple of days. Now, if you're doing an oral treatment, it's really important to make sure that you complete the whole treatment, even after you start feeling better, because if you start feeling better and then you stop taking the pills, the infection may return and it actually might be harder to cure. So just take all the antibiotics as prescribed, and then you don't have to worry about it. Some people also like to take cranberry juice or cranberry pills to help with some of the symptoms. If you have symptoms of a UTI, some people will say that you can just take a bunch of cranberry pills or drink a bunch of cranberry juice to help it go away. If it's an incredibly mild infection, that is a possibility, but I would not risk it. It's something that can definitely help with the symptoms, but it may not make the infection go away entirely, depending from person to person. So kind of know your body, but it does not hurt to follow up with your doctor. So UTIs are definitely something you want to avoid. And obviously, as I sort of mentioned before we kind of got onto the whole UTI tract, is that they can actually be avoided by, a good number of them can be avoided by peeing after sex. So peeing after sex is definitely not mandatory, but it's a pretty good idea. Especially if you are prone to bladder infections, then you really probably want to make a habit of it. It's going to reduce the number of urinary tract infections you get, and the more sexually active you are, the greater the risk of getting them. So having a regular habit of peeing after sex can make a huge difference to your overall health. Now, there's no specific time that you need to urinate after sex. You don't have to jump up and race to the bathroom immediately after. Best recommendation is usually within like 30 to maybe 45 minutes after, but it can be pretty much anytime you're ready. Just make sure that if you're having sex at the end of the day, just try to go before you go to sleep. More likely to avoid a infection that way. Now, if you have a hard time peeing after sex, do not worry. That is perfectly normal. When we're sexually engaged, our bodies actually release a whole bunch of hormones, of course, during orgasm. But part of those hormones send signals to our bodies that they should close the urinary tract. So the muscles tightly contract around that area to prevent any urine from coming out during intercourse. And it can take some time for those hormones to subside and allow the muscles to relax. So if you can't pee right away, don't worry. Just relax, have a glass of water, make sure you're not dehydrated, and try again in a little while. I've had some people ask how much urine has to come out, and they're like, oh, if I only go a little bit, is that going to be enough? The reality is squeezing out a couple of drops isn't really going to be enough to flush out all the bacteria or flush out any potential causes of infections. So try and make it a more regular urine stream for the best results. I think that's all kind of I wanted to cover today. This episode's getting a little long here. So thank you everybody so much for tuning in today. Please don't forget to send in your questions, any questions you may have, to questions@exploresextalk.com. I love to hear questions, thoughts, and comments, anything you have about today's episode. So please do not be shy. You can comment on wherever you're listening to this, or you can email in your thoughts. Also, if you enjoyed this episode, hit that subscribe button, like it, share it, recommend it to someone. Sex ed is not something everybody has, and sometimes they're shy about trying to seek it out. So do your friend a solid and tell them to check out this podcast. I look forward to seeing you all next week for another fantastic episode. And of course,